Good morning, I'm Dr. Lee. Thanks for coming in today. I wanted to sit down with you to go over the results of the tuberculosis screening test you completed last week, and to talk in detail about what they mean for your health moving forward.
係嘅，醫生，我今日就係為咗檢查結果嚟嘅。
So here's what we found. Your IgRA blood test for tuberculosis came back positive. This does not mean you have active tuberculosis, but it does mean your immune system has encountered TB bacteria at some point in your life.
即係咩意思？
What you have is called latent TB infection, which means the bacteria are in your body but they're inactive. They're essentially asleep, walled off by your immune system, and they're not causing symptoms or spreading to others.
即係細菌喺度，但係冇活動，亦都冇令我唔舒服。
Correct. Your immune system has them controlled. People with latent TB have no symptoms and are not sick. Latent TB cannot be spread to others. Only active TB is contagious. You can continue your normal activities as usual.
即係我冇事，唔需要擔心。
Yes and no. There is a lifetime risk, about 5 to 10%, that latent TB can reactivate and turn into active TB, especially as you age or if your immune system weakens.
我究竟係冇事定係有事？我好亂。
That risk may be small, but it's not worth ignoring. That's why we recommend treatment. The good news is that treating latent TB is much easier than treating active TB, and the medications are very effective.
淨係食藥，冇問題，要食幾耐？
There are 3 main treatment options we typically use for latent TB. Each regimen has a different duration and uses slightly different medications, but all are effective at preventing future activation. We'll choose one based on your medical history, liver function, lifestyle, and any medications you're already taking.
明白。
The first option is a 6 to 9 month course of isoniazid, a medication used for many decades with a strong safety record. It's effective but requires a longer commitment, and we need to monitor your liver regularly during this regimen.
時間唔算長，我可以應付，時間眨下眼就過啦。
The second option is a 4-month course of rifampin, which is shorter and generally easier to adhere to. Many people prefer this option because it involves daily medication but for a much shorter period.
更加好，時間仲更短。
There's also a third option, a 3-month combination of isoniazid and rifapentine, taken once a week under supervision. It's one of the shortest regimens we have, but it requires consistent weekly visits or video check-ins to ensure proper dosing.
會唔會好唔方便？如果我揀4個月嘅療程，係唔係好似平時每日食藥就得？
For the 4-month rifampin regimen, you simply take 1 pill every day, just like any regular daily medication. There are no weekly visits or special procedures, so most people find it very easy to manage.
好， 我就試下4個月嘅療程，有冇咩副作用係我要特別留意嘅？
Yes, there are a few possible side effects, but most people tolerate the medication very well. The most common ones are orange-colored urine, mild stomach upset, or feeling a little tired. These effects are usually harmless, but if you develop symptoms like yellowing of the eyes, severe abdominal pain, or persistent nausea, you should contact us immediately.
呢隻藥會唔會同我平時食嘅日常嘅藥有衝突？
Rifampin can interact with certain medications because it speeds up how your liver processes drugs. But based on the medication list we already have from you, there is no interference, and everything looks safe. Are you taking anything else at home that wasn't included on your list, like supplements, herbal products, or over-the-counter medicine?
冇，我淨係食醫生開俾我嘅藥。
For the 4-month rifampin regimen, you'll take 1 pill every morning with food. Taking it with a small meal helps prevent stomach discomfort. Try to take it around the same time every day to keep the medication level steady. And if you ever accidentally miss a dose, just take it as soon as you remember, but don't double up.
好，我明白，我係點樣感染到結核嘅？我都唔記得自己有病過或者接觸過有結核嘅人。
That's a very common question. Most people who have latent TB don't remember when they were exposed because the bacteria can enter the body quietly without causing symptoms. TB spreads through the air when someone with active TB coughs, talks, or sneezes, but sometimes the exposure is brief for years in the past. In many cases, people never know the exact moment they were exposed, and that's completely normal.
嗰個有傳染性嘅人就應該留喺屋企啦，佢唔應該周圍走，仲傳俾其他人。
That's a very common question. Most people who have latent TB don't remember when they were exposed because the bacteria can enter the body quietly without causing symptoms. TB spreads through the air when someone with active TB coughs, talks, or sneezes, but sometimes the exposure is brief for years in the past. In many cases, people never know the exact moment they were exposed, and that's completely normal.
明白。
Before you start the medication, we'll run one more baseline blood test just to confirm your liver function is stable. This is routine and helps us make sure the treatment is safe for you. After that, you can begin the 4-month regimen.
好啦，我2日前先睇過另一個醫生，佢哋已經抽咗我一大堆血，我而家都冇血俾你哋抽啦。點解唔可以直接用我喺另一間診所嘅驗血報告？
The test they ordered is not the same as the one we need today. Different conditions require different panels, and their results won't give us the information we need to safely start your treatment. Your body produces more than enough blood every single day. You definitely have enough for us to draw one small tube. This is important for your safety.
可唔可以唔抽血就開始食藥？
Without this blood work, we don't have a baseline of your liver function, and rifampin can affect the liver. Starting treatment without knowing your baseline would be unsafe, and I'm not allowed to prescribe it without these results. This one test is necessary to make sure the medication won't harm you. Once we have the baseline, everything after this will be much easier.
我每次嚟睇醫生都係呢個要抽血， 嗰個又要抽血，我前2日先剛剛抽完，你而家同我講完全唔算數，點解啲嘢唔可以簡單啲？
I need you to calm down right now. I understand you're frustrated, but raising your voice and acting agitated is not acceptable in this clinic. If you can't control yourself, I will have to call security. We can continue this conversation calmly, but only if you cooperate.
我連你都冇掂過，你話我激動，成日俾你哋抽血，做檢查做唔停嘅係我，依家你仲恐嚇話要叫保安，你完全係廢嘅，唔幫人，冇同理心，冇耐性，邊個醫生會咁對病人㗎？
We will not continue this conversation any further. Your behavior has crossed the line, and I will be calling security right now.
我而家就要見你哋嘅主管，除非有上頭嘅人同我講嘢，否則我唔會走。
Interpreter, this is getting out of hand. We can't continue like this. Thank you for your service today.
我聽得明你啱啱講咩？你叫翻譯員走係唔係？點解？你驚咩啊？翻譯員係證人，你對我差，我哋大家都睇到，你依家係唔想有人見到啫。
This conversation is over. Security is here now, and they will escort you out of the clinic. Please cooperate so no one gets hurt. That will be all. Thank you, interpreter.